Diagnosis of glaucoma at early stage is difficult unless your eye specialist examines your eye completely. Normally the pressure is between 10 to 20 millimeter of mercury and it varies at different times of the day. If the pressure recorded at any time is more than 20 millimeter of mercury, then your eye specialist suspects that you for having glaucoma. Then a detailed examination is required to make out whether you have glaucoma or not. Pressure more than 20 alone is not enough to diagnose glaucoma. It only gives us a suspicion that you might have glaucoma. So further examination like the examination of the angle, optic nerve examination and special test, we call it field of vision, which is wherein the peripheral vision or the side vision is checked, and the scan of the optic nerve, which is called optical coherence tomography of the optic nerve head. These tests help us in diagnosing early glaucoma.